For 20 years, Somalia has witnessed intermittent conflict and violence, with long cycles of drought and floods. Latest estimates show that more than 2 million people, about a quarter of the population, are dependent on humanitarian assistance. 1.46 million Somalis have been displaced from their homes, with virtually no presence of international aid agencies due to insecurity and violence. The only hope for communities lies with themselves. They are coming together to respond to some of these challenges, and agencies like Oxfam Novib are helping to strengthen these community-centered responses.
Oxfam's philosophy is to build the capacity of local communities and their structures and their organizations to be able to deal with their own problems. That is a point of principle, point of departure of Oxfam. That agencies, communities and the organizations which have superior local knowledge, have an understanding of the dynamics and the challenges, have proper social networks through which they can negotiate access and negotiate program choices with much more ease. That is the way to go.
In July 2008, SAACID, a long-term local partner of Oxfam Novib based in Mogadishu, approached Oxfam Novib with information that there were increasing numbers of malnourished children in the city, with 350,000 children under the age of 5 classified as acutely malnourished. Somalia is among the countries with the highest malnutrition rates. In response, Oxfam Novib, working with Valid International, conducted an exploratory study on the feasibility of applying an approach known as Community-based Therapeutic Care (CTC) to treating malnutrition in the context of Mogadishu.
Community-based therapeutic care. Community-based first before anything else, because this program is about the community. Yeah? It's anchored on the fact that anything that you want to do, anything that you want to provide, any service that you want to give an area or a group of people, they need to be involved. The community needs to be involved and needs to be about them, not about us.
The main focus of CTC is community management of acute malnutrition. So it's a way to have basically the community manage malnutrition and have an outpatient program so that mothers don't have to spend weeks in an inpatient facility while their children recover from malnutrition.
Oxfam's exploratory study determined that the Community-based Therapeutic Care (CTC) for the management of acute malnutrition would be possible in Mogadishu, in partnership with SAACID as the local implementing partner, and with the support of UNICEF and WFP, Oxfam Novib embarked on a life-saving mission. Oxfam Novib and SAACID first began by mobilizing community support and participation in the program, alongside identifying public-owned maternity child health centers, MCHs, to be rehabilitated as sites to treat malnourished children. The community also selected core technical staff, support staff, and outreach workers to be part of the program.
markeedu hore waxaan sameynay sahan badan ayaan sameynay sahankaas waxaan sahminay degmooyinka gobolka Banaadir ayaan sahminay meelo ayaan ka soo astaaminay kadib waxaan ku bilownay dhismo inaan dhisno dayactirno oo dayactirkii noola ogolaaday kadib waxaan sameynay baafin markaan dhisno shaqaalihii loo qaada lahaay ayaan baafinay shaqaalihii kadib markaan qaadanay seminaaro ayaa loo furay idaacadaha ayaan ka sheegnay.
By September 2009, 8 CTC sites in 8 districts of Mogadishu began admitting and treating malnourished children.
Caruurta markay imaadaan xarunta nafaqadarida waxaan u kala saarnaa midka nafaqadarida zaa'idka ah iyo midka normalka ah. Waxaan ka soo baxnaa midka oo zaa'idka ah. Waxaan ku fariisanaa maamada kursi ayaan ku fariisanaa cunugeeda ayaan u sameynaa screen muwaag and odayma checking all this markaan ka jagareyno hooyada waxaan micnaha aan KG ga ayaan u dirnaa wait for high loo sameeyaa then waxaan u sameynaa in record micnaha laga record gareeyo informationka waxaa kamid ah in physical examination lagu sameeyo clinical history lagu sameeyo all this markii loo sameeyo cunuga waxaa loo sameeyaa waxa la yiraahdo appetite test
markii cunuga ugu horeyso oo site-ka la keeno ilmaha oo cusub oo dhan waxaa la sameeyaa safaa la geliyaa kadib waan soo baxaa qofka nurse wuxuu sameeyaa ilmihii iyo safku fiirina cunuga ugu daran oo serious ka la soo wada waxaa la keenaa meesha screen-ka isaga shaqada loo hormarina programkii uu galay SFB OTB yaa la geynaa kadib markaas waxaa loo sameeynaa hadii uu noqdo maxay ahayd screen-ka markii la keeno oo hadii uu noqdo OTB ama SFB oo muwaagiis uu galo waxaa la geynayaa miisaankii loo sameeynaa weight for height-ki kadib waa la kaxeynaa waxaa la geynaa hadii uu OTB yahay side-ka dhinaca OTB-da fadhiyana la geynaa hooyada waxaa loo sheegaa faraha inay soo dhaqato.
When children come to the malnutrition center, we classify them into severe malnutrition and moderate malnutrition.
Those who are in the yellow side of the MUAG, we call moderate acute malnutrition. If they have a complication, we transfer into the SC, which is make stabilization, what we call stabilization center. So if they are without complication, we treat as SFB program in our components. So if the child is severe acute malnutrition with a complication, also we transfer into SC. So if the child is also without complication, we treat as OTB.
To make sure that all acutely malnourished children have access to the program, Oxfam, Novib and SAACID work through the community leaders to coordinate an outreach worker network of 40 team leaders and 240 outreach workers. The outreach workers do active case finding and follow up in their designated sub-districts. The network of 8 CTC centers is staffed by a team of 32 skilled nurses and 60 support staff. Community volunteers are on standby to make sure that efficient and quality diagnosis is done and that proper treatment and follow-up is received by every child undergoing nutrition treatment in the program.
sida ay tahay waxa u degsan qorshe u degsan markeeda hore qorshe u degsan wuxuu yahay waxa loogu talagalay labadii usbuucba in la siiyo raashinkoodii la siiyo maanta imaanaysa oo talaada ah laba talaada kadib imaaba la leeyahay waa imaanaysa haddii la waayo oo ay soo naqawayso waxa loo dirayaa oo loo aadinayaa qoladii volunteerska ahayd oo marka horeba guriga ka soo waday oo meesha keenta loo raadinaya keena soo keena leeqafkaas ama maqan saasay ku raadinaysa ilaa cunuga oo ka reystana waa la hubiyaa.
To the women, it's a reprieve from a cycle of violence, malnutrition, and several other general infections. One woman has just brought her child, and she says that finally there is a ray of hope for her loving baby. Another mother's child, on the other side, has just undergone the full therapeutic program and is now cured. What she offers is a huge smile and a thank you to all the partners that have made this happen. In the month of October 2010 only, 1,132 of severely malnourished children and 3,905 moderately malnourished children were received for treatment under Oxfam, Novib and SAACID's care.
We have from the design phase, from the consultations of the community to agree on the program, on the sites, on the approach we are going to take, on the sequence of activities and interventions, on participation with other actors, we have consistently put the community at the forefront. They have been part of the design. And even as we have faced challenges, whether from armed groups or otherwise, it has always been the communities that negotiate access.
With the first phase a success, Oxfam Novib is already mobilizing partners and resources in order to expand the program to the 8 other districts of Mogadishu. This will be done through well-organized steps and adapting to recommendations on a series of processes in line with semi-qualitative evaluation of access and coverage survey. By and large, all the positive outcomes of the CTC program through SAACID, Oxfam Novib is keen on supporting a coordinated citywide health and nutritional network that provides quality and timely care for all the children, pregnant and lactating women in need of their services. Whether it's an island, a desert, or a war-torn area such as Somalia, the reliance on community to propagate the humanitarian agenda can never be ignored.
It's really been successful, and if you look at how much the staff has learned and the community has benefited in terms of lives being saved, and in terms of having these centers there and the community knows they're there and they're open daily, provides a sense of security.
We are happy to say that we have saved so many lives, and we want to continue doing whatever we've been doing all this time. And we really attribute this again to the help from the community, from SAACID being a strong partner in the field who's been able to do this. I mean, technically speaking, Oxfam provided the technical backstop for the program. We have been assessing the program, and we are happy.
The community understands their problems. They know the risks, understand their infrastructure, and accept their own to help them. To Oxfam, Novib, and SAACID, the women and children, those that form the heartbeat of humanity, must remain top on the list for all humanitarian organizations.
Day after day, now as I'm sharing, key messages I'm seeing, how I'm seeing, we know so good that can neighbors can risk it. Email about the message can get to or that self-referral.
The advantage is clear because this CTC program successfully treated many malnourished children. This can be seen from the weekly and monthly basic statistics that we make.
What is wise and what the experience of our pilots and our intervention in Somalia so far have shown is that a program that is owned, run, managed, and appreciated by the community that is part of it, that is the target of this very program, is a program that can withstand both internal and external shocks, whether that is from armed groups or people who have, negative intentions on the program. Sustainability of a program such as the one we have implemented has squarely rested on the ownership and the ability of the community to defend it, because they believe in it, they understand it, they know it is important, and it's relevant for them.